And so it's estimated that up to 1.5% of those in the United States meets criteria for a persistent depressive disorder in a given year. Welcome back, Straight Talkers. Today we're going to dive into the diagnosis of persistent depressive disorder and discuss how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So persistent depressive disorder, which is also commonly known as dysthymia or long-term depression, the criteria range from A to H. So let's break down these criteria further and look at how the diagnosis is made. Criterion A states that one needs to have a depressed mood for most of the day, for more days than not, for at least a 2-year period. And this can be based on someone's subjective and self-reported experiences, or it can be based on observations that have been made by others. And this time requirement varies a little bit depending on someone's age. If we're talking about kids and teens, the duration must be for at least 1 year instead of 2, and their mood can be irritable instead of depressed. Criterion B states that 2 or more of the following secondary symptoms need to be present throughout the depressed period. And these include 1, poor appetite or overeating, 2, insomnia or hypersomnia, 3, low energy or fatigue, 4, low self-esteem, 5, poor concentration or difficulty making decisions, and 6, feelings of hopelessness. Once criteria A and B have been met, the next thing that I will screen for are criteria C through H. Criterion C states that during the 2-year period in adults or the 1-year period in children or teens where the symptoms were present, the patient has never been without the symptoms discussed for more than 2 months at a time. Therefore, it's important to work with your doctor on establishing a timeline that's as clear as possible. Criterion D states that the criteria for a major depressive episode may be continuously present for 2 years. And sometimes people will talk about having double depression, which is when someone with dysthymia or persistent depressive disorder also develops a major depressive episode, and this is something that I'll also keep in the back of my mind when going through these criteria with patients. Next is Criterion E, and this states that the patient has never experienced a manic episode or a hypomanic episode, and the criteria has never been met for cyclothymic disorder. Criterion F states that the disturbance is not better explained by a persistent schizoaffective disorder, schizophrenia, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorders. Criterion G states that the symptoms the patient is experiencing are not attributable to the physiological effects of a substance or another medical condition. Lastly, Criterion H states that the symptoms need to cause clinically significant distress or impairments in the social, occupational, or other important areas of functioning in the patient's life. Once a diagnosis of persistent depressive disorder is made, what I'll do next is break the diagnosis down even further and add a specifier to it. And the diagnosis is usually written out as persistent depressive disorder, and then at the end you'll see one of the following: with anxious distress, with mixed features, with melancholic features, with atypical features, with mood congruent psychotic features, with mood incongruent psychotic features, or with peripartum onset. What I'll then do is also make sure to screen for anxiety disorders, substance use disorders, and personality disorders, as those with persistent depressive disorder are at higher risk for these other psychiatric conditions. Now head on over to the next video and find out more ways that you can help your child live their best life.